I'm Dr. Rick Kelly. Welcome to my channel. Have you heard on certain former news channels that a prominent politician is fine and will recover from his stroke by January if elected to the U.S. Senate? Strokes are the third most common cause of disability and the second most common cause of death worldwide. Physicians are often asked to predict how much and when a person will recover after a stroke by the patient, the family, or the insurance carrier. Well, I want to tell you about two patients. I'll call them Ms. A and Ms. B. Both of these ladies were in their late 60s several years ago. Besides having had high blood pressure for years, both were physically active, non-smokers, and had near normal weights. Both were accomplished pianists and played weekly for their church services. Then, with no warning, both had strokes. Not on the same day, of course, but around the same time. Ms. A and Ms. B went to the ER and received prompt treatment. Both suffered arm and leg weakness on one side. Mrs. A's speech was also affected. Both went through rehab and worked hard to regain function. Both showed improvements over the next 6 to 9 months. Within a year, Ms. B had returned to essentially normal function. She's playing keyboard again and leading the choir at her church. And although Ms. A is improved and she can play the piano a little, the damage done to her right hand coordination has kept her from returning as a church pianist. Let me say up front, when it comes to medicine, you have to remember that each person is different. While these ladies had very similar stories and risk factors, their strokes and the effects on them weren't the same. So what I can say is this. Doctors make judgments and give advice based on an individual's physical and diagnostic findings combined with their understanding of a disease. And they can inform their patients of the likelihood of recovery. But they cannot tell you when or how much a person will, if ever, recover. Only God knows. Understand, though, that like a heart attack is the death of heart muscle from lack of oxygen, a stroke is also the death of brain tissue. If the oxygen and blood flow aren't quickly reestablished, that area of the brain is permanently damaged. Then, in order to regain function, other parts of the brain around it have to take the job of the damaged area. And that's important because, say what you will, the brain is never the same, even if you or I can't notice the difference. So what are the factors that affect how likely a person is to return to normal or near normal function? Well, age is the most important factor, or one of them. The older a person is, the greater the risk of death or long-term disability. The size and the location in the brain of a stroke are also very important, which is why we get CTs and MRIs and other tests to evaluate the size and the scope of the stroke. Of course, larger is worse. The severity of function loss is also an indicator. The worse a stroke is, the less likely it is that that patient will regain function. And certainly the number and severity of concurrent medical problems, or what we call comorbidities, are associated with increased risk of poor outcomes with strokes. Things like cancer, atrial fibrillation, heart disease, diabetes, heart failure, kidney failure, and others all increase the risk of poor outcomes. So when we think about these things, if a person has significant recovery during the first week, well, that's really good. We do know that the greatest amount of healing and improvement in strokes occurs in the first 3 to 6 months. Some people will continue to progress over the next year with hard work. It isn't something that just happens at that point, though. The brain has to be retrained to recover function through intense physical therapy or occupational or speech therapy. In the case of aphasia, which is speech disturbance after a stroke, not surprisingly, the prognosis for full recovery is greatest when a person has a milder degree of aphasia when they have the stroke. There was a study of stroke victims with aphasia that included over 300 who had it when the stroke occurred, the time to maximal language recovery in 95% of cases was 2 weeks in mild cases, 6 weeks in moderate cases, and 10 weeks in severe cases. So John Fetterman, I don't know him personally, and I'm not diagnosing or prescribing for him. But I read in the news reports, like so many others, that he went into the hospital back in 2017 due to ankle swelling. He was told that he had atrial fibrillation, which is an irregular heartbeat and is a common cause of strokes. He said that he didn't take the prescribed blood thinners or follow up with his doctor for 5 years. So he had a stroke this year in early May. And initially, his family and campaign said that he was fine. But a month later, he made a statement saying, "I almost died." The media reported that he had a pacemaker put in also. Those are typically done when a person's heart function is so poor or so weak that they're at high risk of sudden death. So in the debate earlier this week, he refused to release his medical records and said that voters should make a judgment based on what they could see in the debate. Well, what I saw was a man that had speech and language difficulties. He seemed to be able to communicate on a simple level at least. He sometimes jumbled his sentences, but he didn't seem to be able to use higher level cognitive function that would let him have a deep or nuanced discussion of an issue. I didn't hear him make multi-point arguments for any of his positions. I do wish him well and hope he continues to recover. If I had a patient like him, I'd sit down and have what we call a come to Jesus meeting and say, "Do you want to be alive in 5 years?" I'd tell my patient if they wanted to recover, that therapy and optimizing comorbidities are vital. If they have severe cardiomyopathy, their heart may not recover. But I'd tell them if they want to live, then things like medical compliance and regular exercise, weight loss, and reducing stress are vital. Certainly blood pressure control, all these are important. And it's never easy, but as their doctor, I have to give it to them squarely. I think that's all for now. Again, thank you for watching and leaving comments. If you have any other topics you'd like me to address, post them here. I'm going to try to release videos at least on a weekly basis, though I'll probably do like I did with this one if I feel that something's time sensitive. Take care and be well.